Coping with COVID-19, brought to you by Guardian Group. Live easy.
Good morning to you, Onika Henry, clinical sexologist. Good morning to you.
Hi, good morning.
So we're talking about COVID-19 and sex. And what are you seeing? What are you finding since we have been dealing with this
Hello?
situation? Are you hearing me?
Yes, I'm hearing you. Are you hearing me?
I'm hearing you loud and clear.
Okay,
And
good.
as a clinical sexologist, what have you been seeing? What have you been finding since we've been dealing with this situation?
So, with my clients, particularly clients who are couples, I find that some of the techniques and some of the um, activities that I would have suggested for therapy or for coaching, I actually have to ask them to stop depending on their level of exposure. And so people have to find more creative ways to maintain their erotic selves or maintain their sexual lives because of this. I mean, sex requires very close contact. So you're literally putting your partner at risk or yourself at risk if you are working in an environment, if you are in the front line where you are constantly being exposed to the possibility of contracting COVID-19.
Yeah.
So adjusting techniques that I've had to give to clients is one thing, as well as people have been asking me where they can purchase adult toys or sex toys, especially if they're single.
But isn't that illegal in Trinidad and Tobago, though?
So I know the last article I saw, there was an issue with whether or not it's constitutional. And I know sometimes people are allowed to bring in one or two if they're coming through customs, depending on who's working on that particular night. But there are places where people can get. I mean, everybody knows where you can get sex toys, and so illegal or not, they are available. And as sexologists, we actually do recommend certain types of toys depending on someone's challenges or issues or their goals when it comes to their sexual health and their sexuality.
Yeah. Do you find that you are experiencing more challenges now, given the situation, caused through anxiety, fear, and other related, mental health issues that might impact persons?
All right, so it depends on the person. So, for example, some people use sex as a way to distract themselves, to avoid facing issues. So for them, sex is a stress relief. And so people find that now they don't really have that easy access, and I have to give them other ways of maintaining their sexual selves. And then for others, especially those who might be on the front line of fighting this pandemic, they find that there's a complete loss of sexual desire. High stress situations, traumatic situations, especially if experienced consistently over a period of time, will for some people mean that there is no sexual desire left. So it's finding ways to help persons who fall into those categories or who are somewhere in between. So the challenges are definitely greater now. They're different because you don't want people to completely lose sense of themselves in terms of their erotic self. At the same time, you want to make sure people are safe and that they are maintaining healthy practices.
And in terms of the persons that you are seeing now, what are some of the tips that you provide that you are able to share with the public?
Okay, so I'm going to find a way to say this that's acceptable for public consumption. So if you are single and you don't have a partner, but you might have met someone recently, the suggestions are that you continue your interaction online. So you date on the internet, you connect that way. And there are activities and exercises that you can do with each other at this time. And there are games, there are apps that would actually help you maintain your intimacy during time when you're not physically together. For couples who are together, especially if one or both are actually working at the front lines of this pandemic, or those who may find that they are still exposed, or those who still have to travel to work, etc., we are actually not suggesting that you engage in sexual intercourse right now, especially depending on your level of risk. But there are other ways of self-pleasuring that can be done in front of a partner. Once again, there are apps that people can download in which they're playing games online or they're communicating online. And of course, there are precautions that you have to take if you decided, okay, we are going to engage in sexual intercourse. So making sure that you take off, your clothes, launder the clothes immediately. I mean, cleaning yourself and bathing, making sure that you follow the hygiene rules are going to be very, very important for you as a couple if you're going to continue to be physically close
All right.
during this time.
Okay, we're going to have to leave it there. Onika Henry, clinical sexologist, thank you for providing us with that information this morning. And we're going to leave it there this morning on this segment.
Coping with COVID-19, brought to you by Guardian Group. Live easy.